Now we start scanning the suprapubic area to locate the undescended testes. Remember that there is two common location of the undescended testes. One is suprapubic and second is perianal area. So we scanning the left side of suprapubic area. Here we see the skin, subcutaneous fatty layers and muscle layers. Now we slowly sliding the left iliac region. We find no testes. Now we continue scanning to the left perianal area. Here we find out the left testis in the perianal area. The size of testis is small because the growth is compromised. But the texture of test is homogeneous. It is covered by surrounded muscle layers. Now we will check the blood flow for viability of this testis. Minimal flow is observed during the scan, which is not clearly appreciated due to surrounding muscle layers. But the testis appears to be normal and viable. Now we will measure the size of testis. The size of testis is 19 into 11 millimeter. Now we continue scanning to see the spermative cord. Here we see the spermatic cord. which is also less echogenic and appears to be normal as tubular structure. Here we see the epididymis. Now we scanning the right testis, which is present in the scrotal sac. The size of testis appears to be normal, but it shows mildly heterogeneous texture, less echogenic to echogenic texture. Normally it has homogeneous, less echogenic texture. When it is inflamed, it shows heterogeneous texture or echogenic texture. In mild inflammation, the size of testis is always normal, but in moderate and severe condition, the size of testis may be increased. And when the testis inflamed, the blood flow in the testis is also increases, which shows the severity of inflammation. When it is normal, minimal flow is seen in the testis. Now here we see that the blood flow in the testis is increased in all slides. Now we will measure the size of testis. Here we see that the size of testis is normal, 44 into 22 millimeter. The normal size of testis is up to 50 into 30 millimeter or 5 into 3 centimeter. Here we also see minimal fluid around the testis. Here we see the epididymis also shows heterogeneous texture. Now we continue scanning. Here we see spermatic cord. Here we see some membranous fluid in the proximal part of the spermatic cord. The spermatic cord is also mildly increased in size and shows increased echogenicity. due to inflammation. Here we see the scrotal skin, which contain also Debinus fluid and inflamed. Now we also measure the scrotal skin. The scrotal skin size is 9.6 millimeter, which is thickened due to inflammation. Now, how we will write report?